been a busy week for news coming out of the Quebec healthcare system. Some of it may be good, some of it perhaps, I don't know, head-scratching. Let's start with this. The announcement yesterday by Quebec's health minister providing an update on the health plan here, the CAQ's health plan, which he said would include that by the summer of 2026, not next year, by the summer of 2026, he wants all Quebecers to have access to a healthcare professional. Now, I don't know about you, but I'm pretty sure we've heard similar promises to that made before. All it does is it just keeps pushing the ball a little bit further down the road. We now move to 2024 to 2025, and now it's 2026. Now, the nurses union, the FIC, reacted to those comments and to those announcements yesterday, and they say that the advances proposed by the health minister seem to favor instead the strengthening of the private healthcare network and not of the public network, which of course is in complete contradiction to what the government has previously said. So let's see if we can make some sense of this and talk to Jennie Rhee. She's president of the MUHC Nursing and Cardiorespiratory Professionals Union. They are a FIC-affiliated union. Jennie, thanks again for being with us today.
Good afternoon, Aaron.
Let me start with that part about, everyone should have access by the summer of 2026. Blown a lot of hot air here, or what do you think?
I think it's completely a lot of hot air. I think the government understands there's elections coming and they are under extreme pressure because they didn't meet their targets.
So when we say targets, what are we talking about?
Well, they had said that they wanted everyone to have access to a primary care physician or a nurse practitioner or whatnot, some kind of care by the year 2024. It's nowhere close to being a reality. So I think they're kind of understanding that they're under the microscope and they're making a statement that they're pushing it off another 2 years. But what we see and what we feel in the healthcare network, it's deteriorating, and we've been saying it since the beginning of our negotiations. And a year ago today, we were out on the picket lines. I can't believe a year's gone by, and I'm sad to say I think it's gotten worse. And what they're forecasting, what they're proposing, even along medical doctors, it's not enticing people to want to stay here, unfortunately.
Okay, now it's funny you say the part about staying here because we know that, of course, the other announcement made this week concerning doctors is to encourage them to stay here, but I say encourage, to force them to stay here and work in the public system and basically not go to the private system. When I say there's been a flip-flop here, I mean, we know this government, a year ago, 2 years ago, said exactly the opposite, that we need to encourage the private system because it takes some of the strain off the public system. So I'm not sure where we're supposed to draw a line here, which we're supposed to believe.
There's too many things going on, and if you didn't have attention deficit before, you certainly will develop it now. Along medical lines, I have an inside track on that, and I know that since the announcement that medical doctors will be forced to stay or recompensate what it costs to get their medical education here in Quebec, it's causing quite a lot of distress among medical students right now at McGill, and even internally they're speaking about applying outside of the Quebec residency programs so that they're not in that situation when they graduate. Rather than enticing doctors and our medical staff and our professional staff to stay, they're making it even more challenging because, you and I both know the PREM system. Why is it that the medical McGill right now has so many vacancies for family med? Because the PREM system is so difficult to get a position where you'd like to live and work in Quebec. For us, the FIC, you know that the government played hardball with us throughout our entire negotiations. And, Christian Dubé yesterday said, I'm really happy that the contract's on its way to be signed. Ask any healthcare professional today, are we delighted? Are we happy? No, we're not. Our ratios right now today are even worse than they were a year ago. It's awful. We want to give the best care, but they're not consulting the people who give the direct care.
So I know the government has used the word, I know Sonia LaBelle has used that word flexibility in these negotiations, and I know the issue has been with the nurses. Look, we'd like to know where it is we're supposed to work and not just be told pick up here, go there. Is that still the issue?
It is for some places because what we signed and what we agreed to, the majority of the nurses who voted said they were willing to accept that we go back to every establishment, go back to their local collective agreement. We at the MUHC have a solid one, meaning we are not displaceable. We cannot be forced to go anywhere. So we're protected in theory for the next 3 years that remain in our contract. For the other CIS and CIRS, they have a certain amount of flexibility because they cover vast regions that they're allowed to be displaced here and there. The minute it starts happening and it doesn't suit somebody, guess what? They're going to go to the private. because it's still there. This government and other governments before them have always favored that chemin, that road to privatization. And it's easy. People today, they don't like something, they quit, and there's a private job waiting for them right around the corner. And it's that I'm saying that even though, they've offered us more money for overtime and things like that, it's not enough because the work is so strenuous right now today with our ratios. We're running twice as harder as we were like 20 years ago, 10 years ago. And it's that people are finding difficult. We cannot give the quality care. And it's very concerning to us because we leave work wondering, oh my gosh, what did I forget? I left so-and-so. And you feel bad for your coworkers following behind you in another shift because they have to pick up. And then it's just a continuous cycle that we don't seem to be able to end. And, I'm just concerned because they're talking now about budget cuts. They're talking about all kinds of things that is not conducive to a healthcare system that will be functional.
To your point about a budget cut, so there's a story today from RADCAN that says there will be 40 nurses cut, and this is in the CIUS, in the Southwest. 40 nurses jobs. And again, in the midst of all this going on and trying to provide access to care, how are they cutting jobs? That's the first question you have to ask. And then it goes on to say that they're going to have to find $1 billion in savings to return to a balanced budget by March of next year. So if this is the first round of cuts, are we to expect more? Is this where we're heading with nurses?
Oh, we're just beginning, Aaron. We've had our meetings with HR. All of us across the province have had our meetings. I can tell you for MUHC, we're 45 million, 46 million in the hole. Now, while our MUHC, because we give the most acute care across the province, they've said, listen, we're going to try to, maintain and not cut. And I know that they have good intentions, but there is no way that this government will tolerate us going further into a hole. And even though they've said, we got a notice recently that there will be a job freeze, so no hiring of people who don't directly touch patient care. But when you're talking about unit coordinators and secretaries and our support staff who are essential to the functioning of a unit, guess who's going to have to pick up those pieces? In my career, I've emptied garbage cans. I've had to answer phones, put charts together. All these things that don't necessarily belong to nursing, we have to do because we have no choice. But what that does is it takes away from direct patient care, and that can't help but have a direct consequence on the quality of care that the public deserves.
Let me ask you the question here, because the government's tried, I guess the explanation here as to why they're cutting these nurse jobs seems to suggest that these jobs were created during the pandemic when there was, more sort of pressure on the network, and now that we're no longer in that system, they can afford to let these jobs go. Is that an excuse, or does that make sense?
It does not make sense whatsoever. Created or not during the pandemic, and they will say we're cutting vacant jobs, meaning there's nobody in them. But our hospitals are half empty as it is. You cut those positions, you try to recreate them. It's going to be very difficult. You have to pass it through finance and whatnot. There's a lot of paperwork and bureaucracy behind any creation of a position. However, these jobs, whether they were created during the pandemic or not, the needs are still there. The needs exist. So how can you justify cutting anything when our population is suffering? Like the wait times for surgeries are at 23,000 people are waiting? It's unacceptable. We need to get those lists down. And how do you do that? You need to stop those private clinics and create where we can have an environment where our professionals can give quality care in a hospital setting, where doctors have access to the ORs, where ORs are not shut. We have ORs that are shut day in, day out. Reopen them, bring them back into the public, and give the people the surgeries in a timely manner. And when they'd say, our wait list has gone down, I'd like to know statistically how many of those patients have died waiting.
Jenny, we have to leave it there. As always, I do appreciate you weighing in on this. It's going to be very interesting to see how the government answers this now. I'm sure we'll hear from the health minister again next week, and only hope for better news than this. Thank you so much for the time.
Oh, you're very welcome. Thank you, Aaron.
You bet. Jennie Rhee with the FIC-affiliated union, MUHC Nursing and Cardiorespiratory Professionals, asking fair questions. How is this a time, even when you have to make up that money, to let people go within the healthcare system? It just doesn't make any sense.